Hi, today I want to talk to you about diabetes. Now there's two different kinds of diabetes, one that's preventable and one that's not. So we'll start with the one that's not first, and that's type 1 diabetes. The commonly affected population are children and young adults and adolescents. And so type 1 diabetes is basically an autoimmune illness, and your body, for whatever reason, decides that your pancreas is the enemy and it's going to attack it. And so your pancreas's ability to produce insulin, which is a substance that controls your glucose levels in your body, isn't going to work anymore. And so whenever kids and adolescents present to the hospital with type 1 diabetes, it's usually that they have a history of having like weight loss, they're very thirsty, they also are very sweaty and jittery because their glucose isn't where it needs to be. So this is a non-preventable illness, and it is common in children and young adults. So the second type of diabetes is preventable, and I kind of want to focus more on that. And so type 2 diabetes is basically because of something called insulin resistance. And for whatever reason, your insulin receptors on your muscles, and those are the guys that actually help bring glucose into your muscles for fuel, decide that they're not going to pay attention to insulin anymore. And so that's why it's called insulin resistance. And so if you have a big family history of type 2 diabetes, the reason why we say it's preventable is because if you exercise and eat well and take care of your body, you likely will never develop the disease. And so believe it or not, prevention is actually driven towards that. So if you exercise 30 minutes, at least 5 times a week, and eat like a plant-based diet, with some proteins, try to stay away from red meat and only limit that to about a couple times a week, eat more chicken and turkey, but definitely get your fruits and veggies in, you can prevent the development of the disease altogether. If you want to talk more about diabetes, feel free to come by to one of our clinics so that this can be discussed further. For UT Health RGV, I'm Dr. Escalona.